transfemoral shrinkers, so they look just a little bit different. They have this waist strap that helps it stay in place, and we teach people to don these underneath their clothing, so that way when they go to the bathroom, they're not having to also take their shrinker off. This one got turned inside out, it looks like. The tag and the rough parts of the Velcro are meant to go facing away from the skin. So let me fix this real quick. And then the waist belt is not meant to go on the front of the hip, but instead meant to be centered on the side. So like the tag ends up where the seam of your pants would be. And then depending on the looseness of the clothing that the patient's wearing, you can ask them if they're comfortable doffing it, doing some appropriate draping to help them feel comfortable in the moment. The important thing to remember is that the shrinkers or the A-straps for the transfemoral side get up and close into some sensitive areas, so we want to always be mindful of that, not just assuming they're comfortable, but always asking for permission and consent first. So for purposes of just demonstrating, I'll take the lovely boxer briefs that one of the other professors ordered for us off, so y'all can see the first time. And on the inside edge, there's this gusset, so that way that is meant to go right on the inner groin. And you want to get it up as close to where the groin is as possible. Particularly in the back is an area where a lot of patients don't have difficulty getting it pulled up fully. And then the waist strap goes around. This is really strong Velcro. And attaches. Right, so again, if we were doing just the one layer to assess the first couple of days, we'd leave it there. You could tape it to get it out of the way or whatever else. Then let's say 2 days later, everything's looking really great, they're tolerating it well. These transfemoral shrinkers only come in one length. So we always have to cut them to size to get rid of the excess. Otherwise, you'd end up with so much extra fabric bunching up at their groin. So sometimes I'll like fold it, eyeball it first, but try to be conservative so I don't go too short. So I would like start off by cutting it here and then don it, make a mark with my pen or Sharpie, and then make a more, an additional cut of the length. But generally where we're looking for the second layer to end is right there at the groin as well. So if the second layer ended right there, imagine if all this was smoothed out, and at the bottom when it's done up, we want it to be smoothed out and not have a bunch of extra fabric down there as well. So imagine if all of that extra was gone. Okay. So any questions on transfemoral shrinkers?
What position do you usually help don it in? Because obviously this is a dummy and you can move it around and stuff.
Sure.
So do you usually have them
Supine in bed is the easiest because then they can help me lift, roll a little bit. It's also tough just because this like starts to slide as I'm trying to push back. So as you're practicing, you can always have a classmate just like anchor it for you so it's not sliding around too much. It's possible to don them in sitting if the patient has enough hip mobility and strength to hold it up. but if they're really early on, sometimes holding it up for long periods can just be tiring or painful for them, so supine tends to be the easiest way to start. Good questions. Anyone else?
Ideally, would you want to take up the slack in the posterior aspect? Is that like?
Oh, right here. Yeah. So if I was gonna actually fit this to the patient, I would flip it around so that this waist strap wouldn't attach so far in the back where it's gonna be out of reach for them. So they have that one on the back, and then they're supposed to have a matching one on the front. It's just missing. So I would pull this whole thing through the waist belt more, so that way it's more in the front. Put it right there, and then cut the excess of the belt off. Yeah, good question. Ultimately, it just needs to be snug enough on their waist so that way it's not falling down off their residual limb as they're getting up and doing their functional mobility. Okay, any other questions?
There's no sidedness to this, right? Like that's not a left-sided one. It's just like you pull the belt through.
Correct, yeah, it's just where you pull the
I just
belt
can't see
through.
the back, so I can't tell if there's like an angle on that.
Oh, nope,
Okay, cool.
yeah, it could, this could totally be put on this same side of
Okay.